Hi, this is Dr. Rob Rozbruch from Hospital for Special Surgery, and I'd like to give you an update on what we're doing to treat knock-knee malalignment. I'd like to review the various forms of malalignment, including bow leg, where the force between the hip and the ankle goes through the inside of the knee, knock-knees, where the force between the hip and the ankle goes to the outside part of the knees, and of course normal alignment, which is the goal, where the hip to ankle line goes right through the center of the knee, representing the way force is transmitted through the knee. Now, the problems with knock-knees is that there's knee pain, there's an awkward gait, there are problems with body image, people don't like the way it looks, and future arthritis develops. Here you can see an example of a severe knock-knee deformity, and the purple lines represent the way force is transmitted through the knee. You see the outside of the knee is really being overloaded, and bone-on-bone arthritis is the result. So let's look at an example of a pretty typical patient. Her name is Nicole. She's 30 years old. She played basketball in college, and she has developed knee pain over the last several years. She's also conscious about the appearance of her knees, and she's concerned about the future. If you look at this long x-ray that shows the hips, the knees, and the ankles, you'll see that the line between the hip and the ankle goes to through the outside part of the knee. And that is a way of measuring the knock-knee deformity. And again, it shows how the outside part of the knee, or the lateral side of the knee, is being overloaded. When we look at x-rays, front views and side views and merchant views of her knees, we're able to see that the lateral side of the joint, represented by the blue arrow, has some narrowing even at the age of just 30. Planning the correction follows a variety of steps. First, we have to know where the location of the deformity is. And these joint orientation angles show us that it's coming from the femur, which is the most common situation. And this animation with my PACS allows me to create a virtual osteotomy, which is shown here as an opening wedge osteotomy at the distal femur, or just above the knee joint. And you can see with a 9-degree correction, I'm able to achieve a nice realignment. I take these plans to the operating room, where I perform an osteotomy, or a cut in the bone. It's a partial cut, and I wedge through the distal femur. Here you can see I put in a temporary spacer trial with the exact size that I had planned, and I can confirm that the alignment from hip to ankle now goes through the center of the knee. This is stabilized with a titanium plate and screws, and the wedge is filled with the synthetic bone graft. Here you can see the patient several weeks after surgery with the osteotomy healing really nicely and with a really nice realignment. Again, notice that the line between the hips and the ankles go right through the center of the knee. That titanium plate comes out usually at about a year. So here's Nicole before and after, and I'll show you a few more examples. This is Sarah before and after, and this is Chandra before and after, and this is Emily before and after, and this is Ingrid before and after, and this is Joe before and after. Now, Joe had additional leg length discrepancy because it was related to a growth arrest, and we used a slightly different technique using an internal lengthening nail with blocking screws to achieve realignment and also correction of the leg length discrepancy. Here's Bonnie before and after. So our outcomes have been really great. What the results are that there's no knee pain, patients walk really well, patients are really happy with their straight legs, and this protects the knees for the future and prevents the progression of arthritis. I want to thank you for your attention.